If you're expecting identical twins, first of all, congratulations. You are on such a unique and exciting journey. But, it does come with some special considerations we need to talk about. So today, we're going to break down a condition called Twin-to-Twin Transfusion Syndrome, or TTTS, and really get into why early screening is so incredibly important. All right, let's get right into it. This quote really just hits the nail on the head. That amazing bond semi-identical twins have right from the very start. It also means they have this shared lifeline, and that lifeline needs our shared vigilance. It's a truly beautiful connection, but it's one that kind of comes with its own unique set of rules. And that brings us right to the heart of it. This special bond can, in some cases, introduce a shared risk. We're going to explore exactly what that means and, more importantly, how we manage it. Okay, so let's start with a key term you're probably going to hear a lot: monochorionic. I know, it sounds super complex, but it's not, I promise. It just means that the identical twins are sharing one single placenta. Now, this shared connection is amazing, but it's also the very specific reason that TTS can even happen. This just isn't a concern for twins who each have their own separate placentas. So what exactly is twin-to-twin transfusion syndrome? Let's break down the mechanics of what's actually going on in there. So inside that one shared placenta, the twins are connected by all these little blood vessels. With TTTS, an imbalance happens in the blood flowing through those connections. It's not fair. One twin, who we call the donor, ends up giving away more blood than it's getting, and the other twin, the recipient, gets way too much. It's really important to remember this isn't either baby's fault. Think of it more like a plumbing problem inside the placenta itself. And this imbalance, well, it can lead to some really serious complications. For the donor twin, not getting enough blood can restrict their growth. But at the same time, the recipient twin is getting flooded with blood, which puts a huge strain on their tiny little heart. So both babies are at risk. And the condition can also cause issues with amniotic fluid levels and even trigger preterm labor. Okay, I know, that all sounds pretty scary. But here's the really, really good news. This is a manageable condition if you know what you're looking for. And that brings us to the absolute key to all of this: early and regular screening. So let me be super clear about this. For monochorionic twins, screening for TTTS is not some optional procedure. It is a fundamental, absolutely necessary part of prenatal care. It's how we ensure the best possible outcome for both of your babies. And here is the magic number: 16 weeks. This is the point when screening for TTS absolutely has to begin. So why is it so specific? Well, it's because this is the critical window when the condition often starts to develop, and trust me, catching it early makes all the difference in the world. And listen, this is not a one-and-done kind of checkup. After that first screen at 16 weeks, the monitoring has to be frequent. We're talking every 1 to 2 weeks. This consistency is just vital because TTS can progress really fast. This careful watch continues until at least 26 to 28 weeks, right through that critical period of development. So what actually happens during these appointments? I think knowing what to expect can make the whole process feel way less intimidating. It's a very structured and thorough checkup. The screening itself is a multi-step process. First, the specialists will confirm that it's definitely a shared placenta. Then they use ultrasounds with something called a Doppler to track growth, amniotic fluid, and most critically, the blood flow in both twins. They'll also be doing cardiac surveillance, just checking for any strain on their hearts. And if any little sign of TTTS pops up, they immediately get you a referral for specialized fetal therapy. It's all part of a proactive, supportive plan. Which brings us to the big question, the one that's probably been on your mind this whole time. With all this talk of complications and intense screening, just how dangerous is TTTS, really? And the honest answer is yes, it is very dangerous if it's left untreated. But that is the key phrase right there, if untreated. With the kind of close, structured monitoring we've been talking about, and with amazing interventions like fetal laser surgery, the outcomes improve dramatically. Early detection truly is the best path to saving futures. It's a total game changer. So this all comes back to a central idea, doesn't it? The journey of a monochorionic twin pregnancy is a true partnership. It's a shared responsibility between you and your entire medical team. So, if there's just one thing you take away from all of this, let it be this. A shared placenta creates a shared risk, no doubt.
but it also creates a shared responsibility to be vigilant. By understanding what TTTS is and committing to that screening schedule, you become an active, powerful partner in protecting both of your babies. And that empowerment, that's the real key to navigating this incredible, unique journey.